And in this interesting study, large meta-analysis, 43 observational studies, 20 for CVD and 27 observational studies for diabetes. More red meat means more cardiovascular disease. So 11% more cardiovascular disease per 100 grams per day eaten, 26% more for 50 grams per day of processed red meat. So do your best, stay away from these. And in this study about depression, about 6,000 adults were followed. They followed the modified alternate Mediterranean diet score. So again, a way of scoring how well people adhered to this predominantly plant-based diet. And if they did better, they had 73%, up to 73% less depression. And women with the highest adherence had 71% reduced odds of depression, and men up to 79%. So pretty powerful just from the way we eat. This is an interesting study about flaxseed that I thought I would include. Fatty acid analysis were conducted in about 500 participants, and higher ALA levels, which come from things like flax, were associated with lower risk of death, 50% less, in fact. And it turns out that if you have more of this in you, also have slower functional decline and neurologic disease as well. So I work at a predominantly respiratory hospital, and many of my colleagues are always surprised to see their patients do better when they see me, because I help them get rid of inflammation, which is, again, the root cause for all disease, including most respiratory diseases. And it turns out that if you follow people who follow a predominantly plant-based diet, they actually will have slower lung function decline, even in the setting of COPD and emphysema. Again, colorectal cancer, lots more studies have come out this last year. But if you look, if you're overweight in early adulthood, you have 23% more likelihood of developing. In middle adulthood, also 23%. Later adulthood, 21%. And if you're obese in middle adulthood, it jumps to 55% more colorectal cancer. And if you're obese in later adulthood, it's 39% more colorectal cancer. Another study with keto, this was in China, this was in Singapore with Chinese people up to 74 years old, followed for 20 years, and up to 27% more colorectal cancer was noted when comparing the lowest carb, most animal-based, higher fat diets to the least. So is there a healthy way to do lower carb? And the answer is probably, and if you are going to choose a low carb diet, do it with plants. In this particular study, 421,000 participants, a low-carb plant-based diet reduced all-cause mortality by 13%, with each 5-point increase in the plant-based low-carb diet score reducing mortality by 4%. But an animal-based low-carb diet actually increased the risk of dying from cancer, 14 and 16% for cardiovascular disease as well. In this study of 20 randomized controlled trials looking at about 2,000 participants, LDL, the bad cholesterol, blood sugar, and body weight all improved more on a vegetarian diet than they did simply by using the standard therapy for cardiovascular disease. And it turns out that if you can eat this way and you eat you may actually end up with better quality sleep. So diets high in saturated fat have been associated with daytime sleepiness. And in this small study of about 14 patients, they actually experienced a significant decrease in their sleepiness in 21 days. So it worked pretty quickly. How about osteoarthritis? Again, osteoarthritis is an inflammatory condition, and they followed this Plants for Joints randomized controlled trial, 66 people included. And at 16 weeks, the intervention group had a significant improvement in their WOMAC score, which is a way of gauging how bad arthritis is. They also happen to lose more weight, fat, waist circumference, all the usual stuff we see with plant-based diets. And even the New York Times has been starting to regularly cover many of these important issues. This one is showing the link between highly processed foods and brain health. And it says eating packaged foods like cereal and frozen meals has been associated with anxiety, depression, cognitive decline. So finally seeing some mainstream media really call attention to this. There was one positive for red wine out there. And I guess if you are going to drink anything, and I don't recommend you start drinking, drink red wine. But in this particular study, they looked at some of the gut microbiota, and it turns out that red wine may actually help to improve the metabolites seen with good bacteria in the guts. But again, not a reason to start drinking. So if all of the data I just covered does not convince you, consider doing this for the environment. As you may know, the environment we live in, we only have one, actually has a major impact on health. And almost every professional society and major journal in the world has recognized this and reported on it. And it turns out that in the next couple of years, right, we're going to see 3 times the number of extreme heat days. And each of these is going to increase death by 10 people for cardiovascular disease per 10 million elderly. and 0.3 deaths per 10 million non-elderly. And it could be an effect of up to 5 times the number of cardiovascular deaths. And in this particular study, it turns out that if you follow people's diets, you can see that the plant-based eaters actually have much less gas emissions, land use, water use, etc. And comparing to a meat-based diet, a vegan diet results in only 25% of the greenhouse gas emissions, 25% of the land use, 46% of the water use, and 34% of biodiversity loss. So the authors conclude, despite substantial variation, the relationship between environmental impact and animal-based food consumption is clear and should prompt its reduction. In this study of life cycle assessment, which is a way of assessing environmental footprints, they looked at people eating about a 2,000 kilocalorie per day diet, and a vegan diet had 44% less total environmental impact. A Mediterranean diet with content of animal products was low, about 11% in this study, also showed that it had a negative impact. So even a minimal to moderate content of animal foods has a consistent negative impact on the environmental footprint. And I was surprised and happy to see that Hershey's has finally realized that they can make their products plant-based. Of course, this is not health food, but if you are going to go for a treat, you now have an additional option. And then it turns out that even in Europe, and Europe is always slightly ahead of us here in the States in many cases, but it turns out that animal meat and milk sales dropped in Europe as vegan versions hit record highs. And in this particular study, which looked at the cost of these diets, so one of the questions I get very commonly is, Doc, this sounds lovely, but I can't afford vegetables and fruits. But it turns out if you look carefully, the whole food plant-based diet actually costs the least. And if you adjust it to a slightly lower calorie diet, it also costs the least compared to many of the other types of diets. And if you look at the cost of ingredients in restaurants, the whole food plant-based diet also costs the least. I always get a kick out of the surcharges you sometimes see on plant-based foods. It really should be a discount we get. But maybe it's time to make the pharmacy dispense, and not the pharmacy with the PH, but with the F. And if you look at a study that did this, 22 produce prescription locations were looked at with about 4,000 individuals, and programs provided financial incentives to purchase fruits and vegetables, and food insecurity dropped by a third. One level in self-reported health status increased by 62% for adults and 2.5 times for children. Hemoglobin A1C, a measure of diabetes, dropped significantly. Blood pressure dropped by about 10 points, which is more than most of the medications in many trials, and body mass went down. So imagine that if you could actually pick up fruits and vegetables at your pharmacy, the impact that we could have. And it turns out that greater than 2/3 of diet-related cardiovascular deaths could be attributable to diet. In this particular study of 500,000 Chinese, they looked at their diets and their nationwide mortality attributable to diet, and it turns out that was the case. And rates are only going up. Of course, lifestyle includes stress relief, and it turns out that yoga is a great way to get there for people that are willing and wanting to do it. This is a prospective, non-randomized study at a tertiary care center looking at heart failure patients who underwent some sort of coronary intervention. 35 participants were part of the intervention group, and 40 were in the non-intervention group. The intervention group got yoga and guideline-directed medical therapy. And it turns out that their echoes, their ultrasounds of their hearts, actually had improvement, and the functional classes also improved. Maybe we just need to remember 5 modifiable things: body mass index, systolic blood pressure, non-high density lipoprotein, smoking, and diabetes. And it turns out that if we can get all 5 of these, the incidence of cardiovascular disease goes down, and 22% or so and 19.1% of deaths among women and men respectively may be attributable to these 5 modifiable risk factors. And it turns out that many people will leave fish as their last thing that they eat, but it turns out that fish may actually recognize themselves. So perhaps they are more sentient than we ever thought. And it's actually starting to show up in the mainstream, this approach. In every guideline that I see, there's a statement like this: poor nutrition may result in worse heart failure outcomes. In line with our prevention guidelines, a low-salt, plant-forward diet has robust evidence to aid in the management of heart failure patients, including their common morbidities. Lastly, I'll tell you about our results. So we run the intensive cardiac rehab program based on the work of Ornish. And when you get in there after having a cardiac event, we teach people how to eat and exercise and get rid of stress and connect with others. And it turns out when we do this, their cholesterol, their body mass, everything improves, their blood pressure drops, their hemoglobin A1C drops, and they become less depressed and more capable. Pretty amazing just with a cardiac rehab program that's only 9 weeks long. So what is success? Success is a low-fat, 100% whole grain, minimally processed, whole food, plant-based diet. And if you don't believe me, maybe you'll believe Albert Einstein, who said nothing will benefit human health and increase our chances of survival for life on Earth as much as the evolution to a vegetarian diet. I encourage you to check out some of the resources we have. We do a lovely program called Walk with a Doc, which is nationwide. You can find it at walkwithadoc.org and find one near you. If you're in Denver, come join us. And if that's not enough, we also help to support our patients by helping them transition to a plant-based diet on our virtual Zoom support group, which is open to all of you. Feel free to check it out. You can also find it on our National Jewish website. And if you're not convinced, and maybe you're not, spend some time doing your own research. Read about these things, get inspired, get excited, and make these positive changes, because indeed, our life on Earth truly depends on what we do. And with that, I've left some time for questions.
All right. So thank you so much for all that great information, Dr. Freeman. So before we begin, for our participants, how would they be able to get into contact with you?
They can email me, or you can find me on X or Instagram. I'm on most of those. I'm not particularly active, sadly, but you can certainly find me that way.
Okay, and they would just look up Dr. Andrew Freeman?
Uh-huh. Yep.
All right.
And it was on my cover slide as well.
All right, great. If anyone would like to ask a question, you can go ahead and raise your hand in Zoom, and the instructions are in the chat for how to do so if you're not familiar with how to do that. So one of the things that was very popular to say, and it's probably still extremely popular to say this, is, it's genetics, right? If you have heart disease or if you have this and that, it's genetics. To what extent is cardiovascular disease genetic versus environmental, based on lifestyle decisions?
I guess what I would say is, if you think about it, right, many of us think that our genes hold us hostage, and that doesn't need to be the case, right? So yes, genetics is there, and some people might say the phrase you'll often hear is genetics loads the gun and the environment shoots it, right? And so I think if we can figure out a way to change the environment that our genes live in, the likelihood of those genes expressing in a negative way gets reduced. So for those of you that are fatalistic and said, well, everyone in my family died before 40, so will I, see you later. That doesn't have to be the case in many cases.